Shopping centres remain open. I was referring to the food courts in the shopping centres. Shopping centres, retail premises in shopping centres, they will remain open unless they're the ones that I've mentioned about beauty, therapy, tanning, waxing, etc. Those premises, because they're personal services premises, they will obviously not be able to remain open. So I want to be very clear, the shopping centres remain open. In each of the retail premises, there will need to be displayed to assist patrons how many people can be inside that enclosed area in that shop at any one time. That's just observing the 4 square metre rule. I would hope many retail premises were already doing that. I'll be very clear, shopping centres remain open. There's no need to rush out to shopping centres or the food stores or any of these. They will continue to remain open, and you should go and get things as you need them. Thank you. Phil.
Prime Minister, my question, you're now strongly advising people to stay in their homes unless, the need for exercise or going out for essential reasons. Yet at the same time, the shopping centres are open. Is it now just inevitable we're going to move to closing down retail as well?
Well, hopefully this is not necessary, Phil. Hopefully that putting in place the unnecessary gatherings of people and also within our own homes and our residences, by not having those gatherings in our homes of lots of people, as dinner parties with 10 friends and all these sorts of things. No, we can't do that any longer. If we do all the things that Dr. Murphy has outlined, and these other quite strict measures we've put in place about other areas of social gathering, and not having that community game of football down on the lawn on a Sunday afternoon in the park and things like this, stopping all those things, we believe will have a really significant impact, we would hope, on the spread of the virus. But it is important for people to go to the shop. It is important to go to the shopping centre. It is important that they get access to these normal services. It's important for them because they need it. It's also important for our economy that it continues to operate and function as much as possible. So I don't leap to that conclusion, Phil. What we will do is put these measures in place, and should the information change and the advice change, then we should contemplate at that time. But I do note in a lot of the commentary, and both in the public and others, that there seems to be a great wish to go to that point. Well, be careful what you wish for on something like that. Be very careful, because that will need to be sustained for a very long time, and that could have a very significant and even more onerous impact on life in Australia. And we should seek to try and avoid that where it is possible, but if it's necessary for health reasons, ultimately, well, those decisions will be taken at the time. Andrew.
Prime Minister, just this does seem to be something really incongruous about the fact that life as we know it should stop, that we should not be going out in groups, not be playing football in the parks, not be going to the shops unless absolutely vital, and yet you're encouraging kids to go to school. My question on two fronts, one for you, Professor Murphy. Aren't schools now human petri dishes for a virus? What would you do if there is an outbreak at a school? Does it close down? You just keep it going to get it through the children's population? And Prime Minister, separately, are you encouraging schools that have closed their doors to students to reopen after the break, after the holiday break?
Well, I'll make two, and then I'll ask Dr. Murphy to speak on the other matter. I think it's very important, Andrew, that media don't use that sort of alarmist language. I don't think it helps. I would encourage more modest language on these sorts of issues, particularly based on the medical advice that you've heard from us day after day on this issue. So I would encourage a more measured way of talking about these issues, because I think that can cause unnecessary alarm amongst parents. Secondly, you'd have to remind me of the question now, of the second question.
Will you be encouraging
on individual schools? Yes, I believe, and the position of the National Cabinet is that schools should remain open and they can provide distance learning for those parents that wish their children to remain at home. But importantly, for those parents who have jobs, who need to send their children to school for their learning because they can't stay at home with them because they need to be at work. These are nurses, they're doctors, they're people who are working at Centrelink, people doing very important jobs. I mean, even just in the last few days, we have had impacts on our workforce in some of those areas in the public service, which is compromising our ability to do those things. Now, we're responding to it, but what we don't need is arrangements that we put in place which compromise the society's ability to function and to deliver important services, whether that's aged care, whether it's education, whether it's driving a tram or providing public transport. We need to keep Australia running, consistent with the health advice that's being provided. And on the health advice, I provide you to Dr Murphy.
Thanks, Prime Minister. So I think, as I said on Sunday night, Andrew, there is no evidence that we have of major transmission amongst school children. We don't know whether that might occur. We do know that children do not, in general, get symptomatic disease. So I think that analogy is inappropriate. Of course, if there were an outbreak in a school, you would close the school until you'd sorted out who were the direct contacts, and you would quarantine all of those contacts. And of course we need to do measures to protect vulnerable teachers, because older teachers with chronic disease shouldn't be in schools, and that's part of the discussion the Prime Minister is going to have with the education unions. We've got to protect any vulnerable people in our community. We do not see children, fit, healthy children, as vulnerable people with this virus, and schools can do a lot of things to make them a safe place to be with good hygiene. They're already adapting in many ways with reduced classrooms, because some parents are choosing to keep their children at home, and we think a well-supervised, well-structured classroom is probably a safer place than many children roaming the community, which they would probably do if they weren't at school.
In terms of the offences that you were mentioning for those gatherings, what could that look like? Are the states, did they indicate a real willingness for this to go ahead, and do we have the police resources for something like that to be really adequately policed and monitored and executed?
Well, there are two parts to the enforcement, which is a matter for the states and territories, and there'll be opportunities, I'm sure, for media to put those questions to the states and territories and the premiers, as they'll be marshalling those resources and deploying them as part of their responsibilities. There is the actual legal position itself, which means that if something has happened, there'll be the opportunity to follow that up. But in terms of house parties and gatherings like that, well, it is not uncommon for police to be turning up at noisy parties in the suburbs. That's a fairly common Saturday night. Hopefully there'll be far less reason for them to do that, given the strong message that we've sent about those types of gatherings. And it's not just at night either, by the way, it's during the course of the day, just to be really clear about that. And so in taking these decisions, states and territories are very aware of their responsibilities of how they need to take actions to enforce these measures. So I'll refer you to them about how they will achieve that, but they haven't taken these decisions. And I want to stress, these are decisions that are being taken by the state and territory premiers and chief ministers, with myself as the Prime Minister who convenes the National Cabinet. These are not decisions being made by the federal cabinet and instructed to the states and territories. That's not how the National Cabinet works. These are decisions being taken together, heads of governments, to form these views. And in these areas in particular, it is the states and territories that have the lead and the primacy, and so they are coming together and setting these in place. Brett, and then over the back.
Just to clarify, when the travel ban kicks in, is that immediate or is that at midnight tomorrow?
Well, people shouldn't be doing it right now. Yeah. That's the advice. So no one should be getting on a plane and going overseas. We've been making that point for some time. The direction is being worked on overnight, and as soon as that direction is signed off by the Health Minister, it will come into force then, and that will happen tomorrow.
And just, sorry, I have a second question. To be frank, some of the most distressing interviews I've done in a while today with people at Centrelink who were trying all night with children who aren't at school, they've lost their jobs, they don't know how they're going to pay the rent, in tears, in the gutter. They tried to use the website, the phone system crashed. They feel as though when they needed the government most, the government wasn't there for them. Are you sorry about that? And what is the government going to do to make sure that that capacity is there for those Australians?
Well, we are deeply sorry about this. I mean, we've gone from 6,000 to 50,000 to 150,000, all in the space of a matter of day. And tonight they're working to boost it again. I would say to Australians, yes, we are terribly sorry. But at the same time, we are asking Australians, even in this most difficult of circumstances, to be patient. Everyone is doing their best. What we're dealing with is unprecedented. No system is built to deal with the circumstances and events that we are now facing as a nation. And I would urge people, as difficult as it is, work with us. We're working to get this up as high and as far as we can. But we have had a multiple, many times over what is normally expected from this system. And it was already upgraded, and it's been upgraded again, and it will be upgraded again. Opening hours for the call centres have been extended. No resources being spared to ensure that we can get these systems in place. But the support is there, it will get to you, and it is dated from when you've expressed that intent, and that's all registered and that's taken care of. So even if it takes a few more days to get the arrangements sorted out, it will go back to the time from when you needed it. And we'll work through those issues together, and it deeply distresses me, as I know it does the ministers and the secretary of the department and all the people who are working there, trying to get this as good as they possibly can, because they want to get that support to Australians. I want to get that support to Australians, and we're going to do our very best to get there.
On Sunday, the National Cabinet received advice from 22 health experts and lawyers, a bunch of other from the group of 8 universities that the Chief Medical Officer had commissioned. That advice was to launch an immediate and hard-line lockdown that would be very costly, but would flatten the curve immediately and then get Australia out of an economic recession in a quicker fashion. Why was that advice dismissed, and what was the discussion of that advice?
Well, that was not recommended.
There was a group of university academics who convened and provided a diverse range of opinions. It certainly wasn't a unanimous view. There were, and that was not necessarily. They were selected on a basis of their interest in this area, and that opinion, like the opinion of many external experts, was considered by the very large and complex process that we undertook with the Communicable Disease Network of Australia, which is the primary expert advisory group, and the AHPPC, with another half a dozen academic experts in that. And that position was very seriously considered. But, as I said then, and I've said tonight, any measures we place, we believe, need to be for the long haul. The idea that you can put measures in place for 4 weeks and suddenly stop them and the virus will be gone is not credible. So we are very keen to put as restrictive measures in place without completely destroying life as we know it. If Australians all do the right thing with these measures and do exactly what the Prime Minister has said and behave completely differently and practice distancing at every point, that will achieve the outcomes that we want. And we haven't even seen yet what the early implementation of our measures will be. But make no mistake that if there is widespread community transmission, we may have to introduce some harder measures.
And the National Cabinet acts and receives the advice of the medical expert panel, which is not the group you're referring to. That is the medical expert panel which Dr Murphy convenes, and their collective consensus view is what is put to the National Cabinet. Now, I promised here earlier, then we're over there, and then we're up the back, and then Michelle, and then we'll go around for maybe one more.
Prime Minister, many Australians watching at home would think that there is an inherent mixed message that 10 people can go to a boot camp, but you're saying only 5 people can go to a wedding. How do you explain that contradiction? And there are calls from Tony Abbott, amongst many others, saying that if it is inevitable that we have to go to a shutdown, is it not better to do it now? There's very conflicting rules and very complicated rules for Australians to get across.
Well, no, I don't think it's that complicated to understand that only the direct participants in a wedding in an enclosed venue, that would be a necessary restriction. I think that's fairly straightforward. I think people can follow that quite plainly. What we're saying is people shouldn't group together when they're outdoors. Now, what we're talking about of people up to 10 for a training, that is a business. That is someone's livelihood. And you're saying that I should turn their livelihood off And I'm not going to do that lightly. And if it's not believed to be necessary based on the medical expert advice, I'm not going to be cavalier about people's jobs and their businesses. Where possible, the National Cabinet together is going to try and keep Australia functioning in a way that continues to support jobs and activity in our economy, which is not going to compromise the health advice that we're receiving. And so, no, I don't think we should rush to that sort of scenario. I think you could rush to failure in that sort of scenario. You could rush to causing great and unnecessary harm, because understand this country is not dealing with one crisis. We're dealing with two crises. We're dealing with a health crisis that has caused an economic crisis. And I am very concerned about the economic crisis that could also take a great toll on people's lives, not just their livelihoods. The stresses that will put on families. The things that can happen when families are under stress. I'm as concerned about those outcomes as I am about the health outcomes of managing the outbreak of the coronavirus. And it is a delicate task for the National Cabinet to balance those two. Lives are at risk in both cases. And so the National Cabinet won't just rush on the sense of an opinion of inevitability. We will calmly consider the medical advice that is put to us and weigh those things up and make sensible decisions as leaders. I will not be cavalier about it, and neither will other premiers and chief ministers over here.
Prime Minister, Michaelia Cash has announced mutual obligations for welfare will be suspended for just 1 week while the website gets back up. You've outlined a very wide range of businesses that are going to be shut down. Can you explain how that's sustainable to still require mutual obligation after that week? And how will it work with job seekers being required to make job applications with so much of the economy offline?
Well, if those arrangements needed to be extended, then they will. I mean, we are working in a very flexible environment and we're in a position to take further decisions. What we also want to encourage people to do is, right now, I'm looking to hire 5,000 people. 5,000 people to ensure that we can get the support into our social services system so people can get the benefits, and we can upgrade the systems and we can roll that out. There are other places in retail shops, in supermarkets and places like this. There's logistics arrangements that need to be done. In manufacturing, we're producing masks and sanitizer and things like this. Important services. We need people to go and work in those jobs, and we're going to encourage people to do just that. But we will be very sensitive on the mutual obligation issue. It's a matter that is regularly discussed by Cabinet ministers, and we will seek to ensure that it is worked in a compassionate way for people in those circumstances.
Yeah.
Sorry, thank you.
Employers don't need to be wading through those applications.
Prime Minister, on house parties,
Yep.
the social distancing measures have been in place for a while now. As sad as it probably is to everyone in this room, it's pretty clear not every Australian is watching or reading the news. What are you going to do so that all of these changes that are happening almost day by day now is actually explained to Australians in a way that they will understand and receive it? Mr Hunt mentioned today that text messaging would start. Is that happening? When is that happening? How are you going to ensure that even though individually these things might be easy to explain, en masse this is a lot for the public to take in, and they're clearly not getting it?
Well, we all have a job to do in that, you included, the media included, and our public information campaign continues to grade up every single day. It's on bus shelters. People are still catching buses and walking down the street. It's on social media. The official messages that are being put out need to be shared amongst your friends. And that will continue. The public advertising, whether it's on television or radio or the many other means of communication, it is all being deployed and it is all being increased. The text messaging, yes, that will be coming very, very soon, very soon. And we'll be using all of those devices to get that message out. But I think it's pretty clear that most people, if not every person in this country, would know that the coronavirus is having an impact on our country and on the lives of Australians. I mean, it's hard to avoid when you look at the Centrelink queues and not understand that something very serious is going on. So I would encourage Australians to seek out that information from the trusted sources. We've got time, I think, for one more. Phil.
Oh,
sorry, Michelle hasn't had one, and then we'll finish with Phil.
Could I take you to the question of border? There's a lot of credible anecdotal...
Did you say border or order?
Border.
Border, yep.
People coming in.
Yep.
There's quite a lot of credible anecdotal evidence that the checks there, although people are being given material, are not very stringent in some cases. Are you putting any more resources and effort into that, given that the people coming in now must be very high risk?
Well, I wouldn't make the second assumption about high risk. That's not the advice we've had. In some cases, there are high-risk groups that are coming through, and they are identified by the Australian Border Force in terms of how they manage those arrivals. All those who are arriving, and the numbers who are arriving are falling each day, all of them are required to go into self-isolation by public health order at a state level. They're required to do it. It's the law, and that's where they need to go. And that's where they need to transfer to immediately. Not to go by the shops, not to pop in and see a friend on the way home, not to go for a wander around the park. You go straight home and you self-isolate for 14 days. That is the law, and that is the major protection that we have. And that applies to everybody, every Australian returning citizen or resident. And yes, more resources are being put in, Michelle. Phil.
To the hundreds of thousands of people that lost their jobs and small business operators who don't know how they're going to pay the rent, what progress, if any, has been made tonight on trying to, ease people's rent bills, waive them, lift land taxes or whatever?
Sure. A lot of progress has been made over the course of today. And over the course of this week, we'll be looking to hopefully finalise some measures. This is obviously a complicated issue because you've got a tenant, you've got a landlord, you've got creditors, and all of those issues, and you need to solve for the entire chain that's there. But the states, working together with the Treasurer, have done some excellent work today, and there's more work to be done on that. It'll be considered tomorrow night at the National Cabinet and as a first pass to work through that issue, and it will be considered again. But it does involve both the Commonwealth and the states working together. The states have the legislative authority when it comes to tenancies, both commercial and residential, and the Commonwealth has other incentives and levers that it can pull to support, enable that chain of businesses and individuals who are caught up in that process where people are under rental stress. Of course, rental assistance also goes to those who have found themselves out of work and on the job seeker payment. That's one of the many other payments they can get access to, like family tax benefits and other payments that can help them in those circumstances. But rent payments, how much people are paying on their energy bills is another area that we're working with the energy companies, and we've already seen some concessions on that, which we welcome. On top of that, it's mortgage relief, which you've seen the banks already move on, and I think that's another important area. And the work that has been done by the Treasurer with the banks in that area in particular, both whether it's for small businesses or others, I think is really good work to try and reduce the pressures that otherwise are falling on people at this incredibly difficult time. We spend every minute of every day seeking to identify every possible burden or harm that is falling to people in these difficult circumstances, and to ensure that we can do something working with the states to provide some remedy to that. But equally, the same time is being spent on ensuring that we get respirators, that we get personal protective equipment manufactured, that we have enough hand sanitizer. I mean, we currently have, and I'll end on this, we have one of the highest testing rates in the world. One of the highest testing rates in the world. The last number I had before coming in here and going to National Cabinet early this evening was 147,000 tests. And we've been able to secure a supply of hundreds of thousands of more tests into Australia. Testing is critical to how we manage the coronavirus and its impact, as is the contact tracing. And we're doing a lot of effective work there about how digital methods can be also used to assist in identifying contacts and to be able to shut those issues down, as was practiced in Singapore. And so those delivery methods are also being looked at by the Commonwealth, and we're making a lot of progress there. But to fight this fight, there are so many tools that we have to use. But the people we need most are Australians listening, being patient, carefully understanding the things we're asking of them. We know it is a massive change to our lives. But if we do it, and we do it consistently, and we do it patiently and understandingly, then we will get through this. Thank you very much.